He goes, tell me what you do. And so I said, well, I said, I have these 3 slides I just want to show you. And so we talked about how a lot of organizations, to save money, what they initially were doing was putting these high deductible health plans in. And they were doing really good from saving money, but then all of a sudden, claims started going through the roof. High claimants were just piling on year after year, and then stop loss premiums were increasing. And Ed goes, hey, could you send me those slides over? And I was like, sure, I'll send them over to you. And he goes, we're talking about healthcare. And he goes, and I'll send them over to our CFO. And I was like, oh, okay. And so I got home that night, sent them to Ed. He must have sent them to you right away.
Right away.
And that's how I got introduced into you.
Our healthcare costs kept increasing. As Blair said, our stop loss kept increasing. We're owned by an international company that doesn't have healthcare like in the U.S. with their premiums. So I was getting a lot of pressure from them to say, hey, what are you going to do about it? We can't keep increasing our medical benefits and paying through the nose. You got to find a solution. So I started to look outside the Western Pennsylvania for some representative. The only solution they had was either UPMC or Highmark. We had facilities outside of Western Pennsylvania, so which a majority of our employees are in Indiana area. So I had to find a solution that would cover all areas, not just Western Pennsylvania. But again, that was a good thing. I'd never heard of anything, so like you guys are always innovative, so I as a company are always interested in new ideas, not doing the same thing. So these ideas, they were I've never heard, nobody heard them. Our CEO at the to our board, nobody ever heard these terms, reference-based pricing, and so for me, I was really intrigued, to be honest with you. And we had some big players come in here from outside, and we decided they weren't bringing any other ideas either. They weren't bringing these solutions, so we decided to give Blair a chance, and was a pretty hard sell internally for me. I was a CFO at the time, and our CEO was very skeptical, as you know, right?
Right.
And you even came in and had many conversations, and we took back then we decided to make a move, but we took a hybrid approach at that time. So I think that was a smart way to go about it.
So basically, it was a reference-based plan built around a PPO. So basically, employees they had access to in-network and out-of-network, but what that administrator did inside their plan design, inside the summary plan description, is they said any claim above 10,000 basically was cut back to a reference space. So it got cut back to 120% of Medicare. And so that's how they started processing claims.
But again, that's what drives your medical cost is those high claimants, those bills that are over 10,000. You may not have a lot of cases, but if the cases are bad, being cancer or something like that, you're going to get hit with some pretty high bills as a company. So I think that was a really cool approach because it wasn't affecting most people. It was most claims are under $10,000. So it wasn't affecting a lot of people. So it was a big buy-in from our employees. To be able. The other big thing is it was really important. It was it gave access to anybody that wanted to see any doctor. They no longer were caught into an in-network, out-network, in-network. They can go to anybody they wanted. In his approach with, which I thought made a lot of sense too, this high deductible plan doesn't make sense to me, right? Just like Blair said, is like you want people to go to the doctors. People don't go to the doctors, and you're going to end up having some serious issues with your employees. They're not going to get on proper medication. They're not going to know what to do. They're not going to maybe follow any orders, so to me, it didn't make a lot of sense, high deductibles, and I saw that being an issue down the line if you went that way. So what Blair did was he got this hybrid approach. so our employees can go anywhere. They can see anybody they wanted to see. There was no longer, and we made it a simple copay system where we encouraged them. Together, we encouraged them. We want you to go to the doctors. It was odd, you know. Most people don't say that. I mean, oh, I don't want to. Most company and CFOs don't go to the doctors. I don't want any charges, right?
That's right.
But we took the different approach, saying that we want our employees to go to the doctor, catch things, get on proper medication, see doctors, because that's what they're there for. So I think him and I have always had that same philosophy, so kind of connected from day one.
What do you think the employee's perception is of the plan today?
Well, Blair's still here. I'm still here.
That's true.
Yeah, I think pretty good. And if you walked around today when you saw our plant and stuff like that, most people know Blair by his first name.
Yeah.
You know, he's an extension of our workforce, and so you need somebody like him. Wasn't going to be just me, but they wanted to hear it from somebody else saying that, the company cares about you, and they really want you to go to the doctors. The whole design is to take care of you and your spouses, your children, catch things early, and everybody wins in that day. The employees win and the company wins. So I think it's a, fantastic approach that we took.
Yeah. Things change a lot over almost 10 years.
Yeah.
And now we know that outcomes are diminished with high deductible plans and stuff, and it's not always the best saving measure for an employer to go down the route of. There was some other things you did later on. You did some things with pharmacy. You want to talk about that?
Yeah, so one of the things, we were with a pharmacy benefit manager because at the time that specific third-party administrator just said these are basically our PBMs that you can use. And so when we transitioned to another third-party administrator, they had this transparent pharmacy program that basically allowed us to get rebates and really pay the pharmacy what they were being charged. So the savings dropped significantly. Then we talked a couple years later, then we talked about getting rid of specialty drugs. And right now, I think the member cost, what the per employee per month cost is like $52 per month for prescriptions. And people are still getting their scripts and they're happy.
Very happy.
I mean, that was one of the things, the most recent thing was we put in a sort of a concierge for sort of this specialty, and they love it. They're getting calls, they're people, individuals are being followed up with, making sure they're getting their meds and everything's going well there. So
it's the same philosophy. Yeah. I mean, if you can't afford your meds, you're not going to take them, right? And then you're going to be in the same boat. So I mean, he made it, and people were very appreciative that to be able to afford to get the meds that they need, which was a constant stress on from their pocketbook to get those meds that they need. So it was very critical.
Yeah, and that was the fear, is if you carve out specialty drugs, the fear is, well, then it's not going to be covered at all. But in the back end, it was always covered. Members always know that their drugs are covered. It's just another way to get those medications paid for, and the savings is crazy. I mean,
it's amazing
what you've saved. I mean, I always say we when we're talking, but
you should say we, because
what
you've
you've
been a
saved
large part
is
of it.
like it's crazy how much you've saved. I mean,
we've
over the years.
saved millions and millions and millions of dollars from day one. Not only that, but the stop loss was, we were facing, 75% increase. So you can imagine my board meeting and that conversation, but we actually, our stop loss is less than it was when I met Blair 10 years ago. So we were facing a huge increase. Now it's gone the exact opposite. We've been able to maintain that because people are getting the right treatment. We've been able to keep those high claimant bills down significantly.
And that And what's interesting about it is not only the premiums lower, it's the same spec deductible. So the spec deductible
Exactly.
hasn't
Didn't change.
increased.
Yeah, that was
There-
the other
there
thing.
is
We were
no
facing not only the increase,
There
but
is
they
no-
wanted us to increase our risk part of it.
There's no aggregating spec in there. It's straight
Straight.
premium. That's still less than it was in 2018.
So what you're telling me is that from the day you started to now, employees now have co-pay plans rather than high
Yeah.
deductible plans.
Very low copay
Very
too.
low copay
Very low
plans rather than high
copay.
deductible.
Yeah,
Their premiums are better. Your premiums are better.
they can see anybody they want to
see
see.
anybody they want
Yeah.
to see. They get every drug they were ever getting before. They're just
Yeah.
getting it for less
And less money.
Right.
less money, and you save millions of dollars over that period of
Yeah.
time. It all sounds too good to be true.
I know,
Yeah.
it does, doesn't it?
Well, I tell you how true it is. It's never a topic on my board meeting.
There you go.
Yeah. And today I'm CEO, and I think that was a large part of it. That helped me get that opportunity to progress in the
Yeah.
company was, and
Well, it's really interesting to to hear you guys talk about the past and what you've done and what you've achieved, and if catch you off guard on this question a little bit, but what's next? Do you think? What's the areas you want to go after?
well, you know what? I mean, that's what I like about Sherrill Morgan. I mean, because before I never got any ideas, right? The same thing year after year from nothing. But Sherrill Morgan, I think, what I really like working with them, they're always bringing something to the table. They're bringing new ideas. We talked at lunch about some of the stuff, but just hearing something to be able to think about it and ask Blair or get a reference on or something like that. I mean, that's what any CEO or CFO or HR manager that has benefits under, you want that. You want to know what's happening. You want to know the newest technology. You want to know how you can help your employees, and you want to know how you can help your company save money and better your benefits for your employees. You're competing against, you're getting employees. Employees can go anywhere, but if you provide good pay and fair pay and a safe place to work and excellent benefits, I mean, so you're looking for those things that help you keep your employees, your valuable employees. So Sherrill Morgan, I mean, brings that to the table, and every year he's bringing me new ideas, which I love. I mean, I love that, so I appreciate that. So we're almost like brothers, I mean, from this relationship, because he's helped not only me, but all of our employees as well. So I certainly appreciate that. See as an extension of Danzer.
Thank you. That's good to hear. Appreciate that.
Yeah.
Blair, apparently you've done a good job all these years. Guess you can stay employed now.
Right, thank you.
I think that the organizations that you used and that you mentioned to make all this happen, I noticed you were mentioning any of the major healthcare national providers when you were doing this.
No, we actually, so you have your traditional route, your Bucas, your Blue Crosses and Cignas and United Healthcares, but that we didn't use any of those organizations to implement to save money. And I think from a service standpoint, we still have excellent service. And it's been enhanced by a couple of things you've done from a concierge standpoint. So I think from the employee standpoint, HR standpoint even, HR has always been very involved and they love the ideas too, because they see that it's helping employees. So I think,
and there's a lot of the ideas, I mean, HR should love them because, I mean, they dealt with all the headaches before, right? Every time employees had issues, they're calling HR, right? We set up a system where you don't really have to interact with HR. So, I mean, HR professionals, even though they don't like to change, and maybe some of these, they're comfortable with some of these bigger organizations because they don't want to, they see they have more work or do something, but at the end of the day, they have a lot less work. And they can really make a difference for their company. But who wouldn't want to do all this, Mark? I mean, it's your company, you're saving money, you're doing things better for your employees. I mean, what more to ask for, side. So,
Yeah.
So it's a win-win for everybody. Yeah.
Well, thank you. I think that's well said. And I think with that, gentlemen, it's been a great time spending today with you, and I look forward to much more success in the future. Thank you, guys.
You're welcome. Thank you.
Thank you.